Cheekbone augmentation information anatomy. I'm just trying to learn about cheekbone trough augmentation as I decide if it is for me. What are the differences between augmentation on a man and on a woman? Is augmentation done more in the front of the face or out to the side near the sideburns? I have very bad troughs, especially in some lighting and when I get sweaty and it shines. Are cheeks troughs related? I would like to correct both. I would love any and all information on the subject, as I like to be an informed customer.
Thank you for your question. You've submitted several photos and you have essentially concerns about volume in the cheeks and the tear trough area. And you're asking about strategy in terms of difference between treating a man versus a woman as far as the areas of placement and what your options are. Well, this is a very important question, and I think that it's something that I'm quite familiar with doing this every day in my practice. A little bit of background: I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Enhancing the facial structure through different modalities has been an evolution in my practice over the past 20 years. And I would like to first address the thinking before we talk about the solutions. So one thing to be mindful of is, of course, to look at yourself and determine, is an area of concern due to weight loss, aging, or is it just something that has always been a relative deficit that you were born with? Now that's a very important way to make a distinction about how to strategize the type of volume correction, because the goal ultimately is to help you look better and to look natural. And I think that's the origin of why you're asking, of course, the difference between doing cheek augmentation and tear trough augmentation in a man versus a woman. The last thing you want is to look like many people fear, thanks to some celebrities who look very rounded, very doughy, or pillowy. The key is to maintain a natural masculine appearance, but at the same time not to look drawn or gaunt. So when I first was in practice, and for many years, basically before the introduction of hyaluronic acid fillers, the approach was to always use some kind of a facial implant, whether it was a tear trough implant, a cheek implant, or a combined implant. It was basically the strategy of a surgeon to place an implant. Now move the clock forward to the last couple of years, we actually have fillers that are longer lasting, such as Juvederm Voluma, Juvederm Ultra Plus. However, one of the challenges is where exactly to place, in what anatomic space. A lot of times people get frustrated before they have come to us about the placement, because most of the time doctors will place the filler only in these soft tissue spaces, which means just below the skin. In our practice, we do something called structural volumizing. This is a very distinct approach and unique in that we're placing the filler at the level between the bone and the muscle, essentially the space which gives you more structure and does not create this rounded look. It's not saying that soft tissue filling is invalid, and it's certainly, there's many patients who I combine the two. But placement on the structural level, at the bone level, is a very specific method and technique. Now when I do this, I also keep in mind, of course, what the patient's concerns are, but I think a general idea to at least understand a little bit more is the concept of the golden ratio. When you look at attractive faces, whether it's men or women, there is a certain balance to the width of the cheekbones versus the width of the jaw. And that balance is essentially a 1.6 to 1 ratio. And there are different parts of the faces where this 1.6 to 1 ratio, it's also known as phi, or the golden ratio, is derived from Greek. And it is seen throughout nature, and it resonates with people, as it is, I think, hardwired in our DNA to see that balance as being attractive. So when people look drawn or gaunt or have a relative deficit, strategic placement can be very, very effective. We have to have a strategy. We also have a wide range of injectable fillers to choose from, whether it's in the Juvederm family or the Restylane family. We have a lot of options in terms of relative thickness, the stretchability and memory, as well as the thinness and elasticity and diffusibility of these different fillers. So we live in a very, very fortunate time. It's like being an artist and having lots of different paint. You actually have a lot to be able, we can use to customize. The discussions with your doctor is critical. When I talk to my patients, I take a lot of pictures. I review their pictures with them. They often discover different areas, aspects of their face that they didn't realize because they were focused in on one area. People always do this. They look in a mirror and they focus in on an area that bothers them and sometimes miss the forest for the trees. So after reviewing their photos, I'll actually just draw on them with an erasable marker, and I'll show them where I think the volume will be of value. Once that's done, we then decide what fillers to use, and then the patient decides what they'd like to do and maybe what they'd like to wait to do. But it is a strategy, and certainly there is, of course, a difference between how we place fillers for men versus women. I think that in terms of the central facial area, men tend to be more likely to prefer a flatter look, and women tend to prefer a softer look. But again, there is a lot of variation there. But my preferred approach now is not to put facial implants in those areas, but rather to use long-lasting fillers. These long-lasting fillers can last up to 2 years, as an example of Juvederm Voluma. So when you think about it, there's a benefit of longevity and not having to come to the office every few months. And I feel what's more important for me is the control. I can really be very precise. If one area of the face has more projection than the other area of the face on one side versus the other, which is very common, then I can add a little bit more on one side compared to the other. This flexibility is so liberating, and it is so nice to be able to do that. And we spend a lot of time in doing these procedures. We never rush through placement of fillers. I always treat placement of fillers like I do surgery. We use extremely sterile technique, and we do things in a very formal way to minimize potential issues and to give the patient the appropriate amount of time in order to get an optimal result. And that's how we work. And generally speaking, it has worked out very, very well. The convenience of having a procedure where you can get facial volume, structural volumizing performed in 30 minutes with just a little bit of local anesthetic and almost always no bruising or minimal bruising, it is great. And this is in significant contrast to a surgical procedure where there's going to be a certain amount of healing process. Doesn't mean that there's no value to cheek implants or tear trough implants, but I think that as an initial process, the injectable filler placement ends up being not only the initial process, but it becomes the preferred process for our patients. You can't beat the convenience and the ability to just not have to have any downtime. So meet with qualified, experienced doctors. I think surgeons have a unique perspective, because a facial cosmetic surgeon has operated at the bone level, has seen everything. And I think that there is a certain informed view of placement that's going to be different from someone who hasn't done that type of work. And of course, this is an area that people get sensitive about, but that's my perspective. So I hope that was helpful. I wish you the best of luck, and thank you for your question.